Yes, bundle up. Well, now that it's a bit chillier outside, the last thing you may be thinking is taking a cold bath or a cold shower. But experts actually say that this may be good for you. Well, here's Dr. Kohli with more.
Well, studies are coming out. I don't know if you guys have seen this, but cold plunges and cold showers are the thing now. Dr. Kohli is here to talk to us all about it. Okay, first of all, tell me about a cold plunge, what it is, and how do we do one?
You know, it's been around for hundreds of years, Danny.
Okay.
It's from the time of Hippocrates, actually. He's sort of called the forefather of cryotherapy, which is cold therapy. And it's supposed to have medicinal uses. And the idea here is to sort of take your body temperature, cool it down very quickly with getting into a bathtub or a swimming pool that's down to about 55 to 65 degrees. Okay. You just suddenly submerge yourself in there, and you're supposed to spend about 5 to 15 minutes in there.
Oh, God.
Yeah. And it causes a lot of physiologic changes that can have medicinal benefits.
Okay, so tell me about some of these benefits because, like, nothing sounds worse to me. I'm sorry. Oh, my gosh, this is crazy.
Yep. So basically what happens when you sort of put your body into that stress response, it triggers a whole lot of stress chemicals. Now, that sounds like a bad thing, but small little bursts of stress can actually improve the circulation because your body's kind of like in a fight or flight response. So it starts redistributing the blood flow pretty quickly, especially when you get out of that cold plunge. So it can help with circulation problems. It can also help with inflammation because when you have more blood flow, you're actually kind of washing out all those evil humors, like the pain-causing chemicals and things like that. So it's actually rinsing away all the bad inflammatory things that are there and helping to reduce inflammation. It can help with muscle soreness as well. And then when you do this, it can affect the way that your brain also gets blood flow. So you can release sort of neurotransmitters that help you with mood. So you can feel a little bit better. It's called a euphoria. After you do kind of that cold plunge, you feel a little bit of a high.
Wow. Okay, interesting. So you said between 5 to 15 minutes. This is something to me, again, that sounds awful, but I have to say I did do this for about a month. I took a 5-minute cold shower. I have to ask, is it better if you go longer? Like if I would have done 15 minutes, would it have been better for me?
No, in fact, you actually want to be careful because you don't want to go from nothing to like 20 or 30 minutes all at once because you can actually cause damage at that point because your body's not used to it. That stress response can be maladaptive if it goes too long. So if you are going to try this, you want to sort of work your way up to it. So start with a 2-minute cold shower, then maybe 5, then maybe 7. So sort of work your way up. But really what the data shows is that small to medium bursts of the cold plunges, the 5 to 10 minutes is sort of the sweet spot. And if you start doing too long, it can start to have maladaptive effects. And then don't go super cold right away. So that's the other piece of kind of working your way up to it. Don't jump into an ice water bath if you've not used to it. You really want to start with maybe a little bit cool and then a little cooler and then kind of work your way down to that 55 degrees.
Okay, so what about kind of the reverse of that? I've just done a cold plunge or taken a cold shower and I am freezing, so I want to get in the warm water. Is it bad if we go from cold to hot immediately?
I would say so. Because you're, again, not only are you shocking your system, you're confusing your circulation, right? Because when your body's cold, your internal temperature drops, the blood vessels on the skin constrict because it wants to redirect the blood flow internally. And now all of a sudden, you've got all this heat on you and you warmed up your body temperature so quickly. And so you can cause problems with cell function, you can cause problems with proteins, you can cause problems with the circulation, your blood pressure, you can feel faint or dizzy. So you just want to be careful about shocking your body right back into that hot water.
That makes sense. It also kind of hurts a little bit, that I have to say. Okay, so who should not be doing this? Are there people out there that this could be risky for?
Yes, and that's a really important lesson here. So before you start any kind of program like this, make sure you talk to your doctor, make sure it's okay. Certain medications can affect your body's ability to regulate temperatures. You don't want to do that if you're on certain medicines. High blood pressure, heart disease, diabetes, because that affects your nerves. Any of those are contraindications to doing this. And even if you're older, because we know that as we get older, after the age of 65 usually, we have trouble regulating our body temperature, so you don't want to be doing this. So it's an interesting kind of novel therapy to try for certain people for muscle soreness after workout or what have you, but it can have its risks, so you want to be very careful.
Okay, I like this idea though, you know, kind of shocking the body and making us maybe kind of get a little bit better when it comes to our circulation as well. You can't go wrong. Dr. Kohli, thank you.
Well, make sure to email us your questions for Dr. Kohli. Just send your message to mycoco@9news.com and put Kohli in the subject line.